TAVI is an abbreviation. It stands for Transcatheter Aortic Valve Implantation. It is a relatively novel technique. It's been around for 20 years now, and it came about because patients who have a particular common heart valve condition called aortic stenosis, who tend to be more elderly patients and patients with other medical conditions, were only treatable by means of open heart cardiac surgery. And approximately a quarter to a third of these patients were either too unwell or too frail or too high risk to be offered surgery. And these patients were left effectively untreated and did very poorly. So TAVI was developed as a non-surgical technique whereby an aortic valve is delivered and implanted in the heart in place of the existing narrow diseased valve, but with the advantage of the patient not requiring surgery or not undergoing surgery, with the associated risks of having their chest opened, going on a ventilator, spending time in intensive care. And it was a fairly crude technique initially, but over the 20 years the technology has developed. It tends to be the more older patients who undergo TAVI, but there's increasing data and research that has been carried out in various populations, and there is actually encouraging data that even younger patients with aortic valve disease do well with TAVI, and these cases are now increasingly discussed collaboratively in a teamwork approach between ourselves cardiologists and our cardiac surgeon colleagues, where we try and effectively work out what treatment best suits an individual patient. So we try and tailor the treatment to an individual rather than having a blanket approach or an age cutoff.